Guys, if you can spare just 2 minutes of your day and answer this question, you are revising a high yield ENT concept that has been asked repeatedly in NEET PG, INISET, and FMG. So don't jump to the answer. Now, read the question carefully and try solving it. So, a 32-year-old man presents with decreased hearing in the right ear. On examination, the Rinnes test is negative in the right ear and positive in the left ear. So, Weber's test lateralizes to the right ear. So, what is the most likely diagnosis? So, you have four options here. Option E is right sided conductive hearing loss, option B is right sided sensory neural hearing loss, and option C is left sided conductive hearing loss, and D left sided sensory neural hearing loss. So, pause the video and think and comment the correct answer. So, Rinne's test. Rinne's test may be negative or positive. Negative means bone conduction is more than air conduction, and positive means air conduction is more than bone conduction. Negative indicates there may be conductive hearing loss, and positive indicates there may be sensory neural hearing loss or normal. Yeah. So, what is this air conduction and bone conduction? Air conduction is like normally air conduction is more than bone conduction. Yeah. The sound travels through external ear, tympanic membrane, middle ear, and cochlea. So, that's how air conduction is more than bone conduction. But in conductive hearing loss, there is a problem in this external ear, tympanic membrane, and middle ear. So, air conduction pathways block it. That's the reason we see bone conduction is more than air conduction. So it is seen in impacted wax, CSOM, otitis media, and middle ear effusions. Whereas in sensory neural hearing loss, there is a problem in cochlear or auditory nerve. So here both are decreased, but AC is more than BC. Like air conduction is more than bone conduction. So it is seen in presbycusis, acoustic neuroma, and noise-induced hearing loss. So whenever you see negative Rini, you can infer like you can think at as conductive hearing loss, and whenever you see positive you can think it as sensory neural hearing loss or normal hearing, so normal. So from Rini alone we already suspected right-sided conductive hearing loss, and now we have to confirm it with Weber tunic fork at the midline of vertex and ask which ear can, like, it is lateralizing to which ear. So the specific things we see here is uh, it lateralizes to the deceased ear in conductive hearing loss. So if it is lateralizing to the deceased ear, it is suggestive of conductive hearing loss. And if it is lateralizing to the normal ear, if it is suggesting sensory neural hearing loss. And if it is equal in both ears, that may be normal hearing or symmetric hearing loss. It may be anything. So in the question, the Weber's test is lateralizing to the right ear. That means the right ear is deceased ear. We have like seen from the Rinne's test that the right ear is deceased ear. So if it is lateralizing to the deceased ear, what does that indicate? It indicates that side conductive hearing loss. So right-sided conductive hearing loss is the answer there. That's how. So this is a summary table. If you remember this, you are going to solve many of the MCQ questions. So normal hearing, the Rinne's test will be positive in both ears. That is AC is more than BC. And Weber's test is equal in both ears. And interpretation, yeah, it's normal. Right-sided conductive hearing loss. As it this is a question case, so it is negative in the right ear and it lateralizes to the deceased ear. So yeah, right-sided conductive hearing loss. And left-sided, what happens? Rinne's test will be negative in the left ear and conductive hearing loss, so it will be lateralized to the deceased ear. So it will be lateralized to the left ear. And right-sided sensory neural hearing loss. That means it's positive Rinne's test in both the ears and it lateralizes to the left ear. Yeah, because this is lateralizing to the normal ear. That's the reason. And the left-sided sensory neural hearing loss, same, positive on both sides for Rini and lateralizes to the one important exceptional case you should know here is the false negative Rini. So in several unilateral sensory neural hearing loss, what happens is When the tuning fork is placed on the mastoid of the affected size, it may be actually heard by the normal cochlea on the opposite side through skull bone conduction. So we think it is heard from the same side. No, but most of the times it is heard from the opposite side, normal cochlea. So this can make the test appear negative even though the patient does not have conductive hearing loss. That's why we always correlate Rinne with Weber's test. Yeah. So, if this helped you revise an important concept in under 2 minutes, yeah, save this post and share it with your friend preparing for NEET PG. Thank you. See you in the next